The biggest update yet from President Trump since he tested positive for coronavirus. Tonight, the president released a video saying he's feeling much better now and is confident he will beat COVID-19.
I'll be back. I think I'll be back soon. And I look forward to finishing up the campaign the way it was started and the way we've been doing, and the kind of numbers that we've been doing. We've been so proud of it. But this was something that happened, and it's happened to millions of people all over the world, and I'm fighting for them. Not just in the U.S., I'm fighting for them all over the world.
Good evening. In that 4-minute video, President Trump says he, quote, wasn't feeling so well when he was admitted to Walter Reed National Military Medical Center yesterday. But he says that he feels, quote, much better now, and that, quote, we're working hard to get me all the way back, he says. The president sounds a little raspy, but he appears to be in good spirits. Doctors say the president faces a critical next 2 days in his fight against COVID-19. His chief of staff also said today President Trump went through a, quote, very concerning period yesterday. News4JAX reporter Maggie Lorenz is joining us in the studio, watching tonight what comes out of the White House and Walter Reed Hospital. Good evening, Maggie.
Good evening, Janice. The questions, they're growing as the president has spent his first full day at Walter Reed Hospital, and the circle of current and former aides to the president testing positive is rapidly expanding. Earlier today, President Trump's doctor addressed his condition in the first briefing since his COVID-19 diagnosis.
The first week of COVID, and in particular days 7 to 10, are the most critical in determining the likely course of this illness. At this time, the team and I are extremely happy with the progress the president has made.
President Trump's physician, Dr. Sean Conley, says the president is fever-free and not having difficulty breathing. But he didn't say when the president contracted the virus, later clarifying that he was diagnosed Thursday evening. This is now raising questions about the timeline of the illness.
If you look at the calendar, if he started to develop symptoms, on Friday or Thursday night, whenever it may have been, go back 2 or 3 days. Go back. Those are actually end up being the most critical days. That's the beginning of the week. That's during the debate. That's during all that travel.
Dr. Conley did confirm President Trump was treated with the therapeutic remdesivir and received a dose of Regeneron's experimental antibody cocktail. I spoke today with a local infectious disease specialist who says remdesivir is meant to help COVID-19 patients recover faster.
In general, a lot of the studies that have been done to show that it works well has been with mild to moderate to severe cases. So in the hospital setting, that's where it can be used by IV only. You use it when patients' oxygen saturation is below 92%. So it's not used on people that are not usually requiring oxygen and are breathing just fine. It is used for people that are requiring some oxygen support or their oxygen saturation has gone below 92%.
One of Trump's physicians today said the president is not on oxygen, but would not say if he had been given oxygen at any point during treatment. The White House has been working to trace a flurry of new infections of close Trump aides and allies. Attention is focused in particular on last Saturday's White House event introducing Trump's Supreme Court nominee Amy Barrett. Among those who attended and have now tested positive, former New Jersey Governor Chris Christie, White House counselor Kellyanne Conway, the president of the University of Notre Dame, and at least 2 Republican lawmakers, Utah Senator Mike Lee and North Carolina Senator Thom Tillis. And Senator Ron Johnson is now the 3rd Republican senator to test positive for COVID-19.